One of the most common heart problems felt by almost everyone at one time or another is called an arrhythmia. That's a palpitation or skipped beat that's usually ignored, but sometimes an arrhythmia can be an indication of something more serious. CBS 2's Dr. Max Gomez reports there's a new, safer way to treat the condition with the power of magnets.
I knew my heart didn't feel right. I kept on saying, my heart doesn't feel right, but my heart doesn't feel right.
Shasi Wells' heart wasn't right. The 24-year-old had a serious heart arrhythmia. It was beating irregularly enough that
all of a sudden my heart was racing for no absolute reason. I was sitting down and I ended up passing out.
Shasi's problem was potentially lethal, so she ended up here in the cardiac electrophysiology lab at Valley Hospital in Ridgewood, New Jersey. The standard procedure is to make an electrical map of the heart to find where the abnormality or short circuit is coming from. Then
we put in a burn or cautery type of burn from the tip of the catheter to interrupt that circuit.
The placement of that burn has to be exact. Hard to do when you're steering a tiny tip at the end of a 3-foot-long catheter. Now there's a better way.
Our catheter, the catheter tip has a magnet at the end of it, and the catheter is soft, which means it can be positioned within the heart without creating any risk of perforating or injuring the blood vessels or heart.
The magnet on the tip is only half the solution. The rest lies in these two huge magnets that straddle the patient. The doctor can actually move the magnetic field around the patient with a computer joystick, which steers and navigates the catheter tip into exactly the right spot to zap the short circuit.
It's like a GPS for the heart in a sense.
It's exactly a GPS for the heart.
Shasi was home less than 24 hours later.
I feel amazing. My heart, I feel so great.
This system is not just safer for the patient because the doctor can steer by remote control in a separate room. He or she is exposed to much less radiation, minimizing the chance of developing cancer from years of x-rays. Dr. Max Gomez, CBS 2 News.
And Dr. Max also tells us the magnet system can be used on any kind of heart rhythm or abnormality, and it's now being developed to help replace pacemakers, heart stents, and even brain catheters.